Hola, soy el Dr. Peter Lee de los EEUU. Trabajo en Jiahui Health. He sido un médico de medicina familiar por 25 años.
こんにちは。上海国際病院の矢野恵子と申します。私は日本出身で卒後20年、上海に来てからは13年ほど家庭医として働いています。
Hello, my name is Victoria King and I am a family doctor from the UK, London, England, and I have been in Shanghai for about 6 years now, joining this wonderful Jiahui family medicine family.
Mein Name ist Magdalena Netzek. Ich bin Ärztin für Allgemeinmedizin und arbeite hier in Jiahui Health in Shanghai. Ich komme aus Österreich und bin in meiner Funktion schon über 10 Jahre tätig.
我是邱玲医生，我从美国回到上海已经4年了，目前任嘉汇全科和健康管理中心的主任。
Which was over 35 years ago, I decided to become a physician because I felt family physicians can serve an important role in society.
GPs can see the patient in all generations. If we see adult patient, more novel than not, they have concerns about their family members, about their parents' uncontrolled health issues, about their partners' sleeping problems, and about their children's growth. If I were a doctor who is capable to handle all the problems, I think it would be nice for both of us.
The reason what made me want to become a doctor is many years ago when I was very young, I remember cutting my head and having to ride in an ambulance to go to the hospital. And I encountered a very patient and friendly doctor and nursing staff, and they took really great care of me. And from that point, that was the reason which made me want to become a doctor.
In Austria, GP training starts after medical school. That means that you rotate from different departments. So you have surgery, internal medicine, pediatrics, gynecology. You see all the varieties of the medical field, which gives you, of course, a broad introduction to different patients and different cases.
我想成为一个温暖的、亲和的、专业性强的健康伙伴，帮助患者从预防做起，做到早发现、早治疗，在患者需要的时候，帮助他们协调医疗资源。
After coming to China to work as a family physician, I'm pleased to be able to apply my knowledge and skills from 20 years in the medical field. Definitely, there are differences between the peoples and the health systems and other aspects. Fundamentally, though, people are still people with physiologic and psychological needs and wants, and health systems are still health systems, which try to meet those needs and wants with their people, resources, and processes.
There are quite a few similarities and differences between the healthcare systems here in China. Their problems may be more what we would call acute, so they may have some coughs and colds, things which are fairly recent. Whereas in the UK, from my experience, I would probably see patients who have long-term diseases.
When it comes to patients, I think no matter where you are, they have the same concerns about their health. And as my patients here are mostly foreigners working in China, they expect an international standard of care. And luckily working here, that gives me the opportunity to provide my patients with the same standard of care as back home.
I feel like China is more focusing on specialty care. That's why family medicine has a more challenging job to take care of the whole family. But that's why we are here, right? Secondly, medicine is an art. It's not really 100% science. We want our fellows, our family doctor to know we are not only focused on disease, and also we need to focus on a human being. That's the difference.
In my opinion, patient-centeredness is one of the most important things to be a good general practitioner. What I usually do to get that point is listen to the patient's story with empathy. If we see the patient with abdominal pain, we usually order ultrasound of abdomen to get what causes this pain. Even though we received the same result of the examination, we need to explain it in different way, from patient to patient, according to their concerns.
When you work as a GP, patients come to see you with all different conditions. So basically, they can range from head to toe. So as a GP, you have to be able to triage see what needs immediate attention, what can wait a bit, and what needs to be referred. Definitely it helps as a GP to be very patient, but also to be curious and to enjoy lifelong learning.
Family doctor take care a lot of common disease and also manage chronic diseases. However, I think the most important thing is family doctor need to know your limitations. When you know your limitation, you will not delay any diagnosis or treatment of a severe disease, and we always need a specialty help that situation.
You are urged to be ambassadors and leaders in our unique, exciting, and ever-evolving specialty. Keep learning, stay aware of and adapt to our environment. Stay resilient.
For the next generation of family doctors, it's very important for them to know we need more qualified, high-quality physicians to continue our work. That's why Jiahui has this family medicine international skill enhancement program. We really want our young physicians to learn broad knowledge. At the same time, we encourage them to have a leadership to continue improvement for our healthcare system so we can benefit more people in China.
Keep making a world of difference in your journey in family medicine as you provide continuous, comprehensive healthcare to your patients.